Just correct this pelvis that's pulled back and down, and I'm gonna drive it forward and higher and relax here. All right, other side up. Hello everyone, Dr. David Kulla here with Synergy Wellness in New York City. We have another case of Coccyx pain or tailbone pain. For those of you that don't know what the coccyx is, it's that little tip at the bottom of your sacrum, and it can be painful when you fall on it. So if you've had a slip or a fall on the ice or on the stairs, or in this situation, you were working on a light fixture or an electrical issue, right? Yeah. And he came down on top of an armrest. An armrest that was stuck there. So when he came down, he landed right on it with his tailbone and has had tailbone pain and low back pain for how long?
A little over a year.
A little bit over a year now. So he saw our video, I guess, and that prompted him to come in. And this is why I do this, not so we can get patients, but so we can educate people on how these simple problems can be fixed, but not typically with medication, all right? So we give you alternatives to fix some of these problems, and oftentimes there are physical problems that need to be dealt with a physical manipulation or physical work done on that area, not with a medication from the outside in. That's not what we do here. So we've been working with you. This is what, our third or fourth visit?
I think this is the third one.
Third visit. How much improvement have you seen? Let's start with the low back pain.
No, the lower back pain has been about 80%.
80%?
Yeah.
Okay. And how about the tailbone pain?
I would say anywhere like 20 to 35%.
Okay, 20 to 35% improvement with the tailbone pain. He can sit a little bit longer. He doesn't have to sit with a donut. So if you can imagine it hurting to sit all the time, standing all day isn't fun either. So we need to fix this for him. So we've gotten about 25 to 30% improvement with the tailbone pain. It's hard for him to get here because he comes far. So that's been a little bit of a hiccup. He probably would see about closer to 50% improvement had we been able to, see him 2 to 3 times a week. So we're working on that. It might be a little bit of a slower recovery for him. So for those of you that are dealing with tailbone pain, coccyx pain, and you're seeing a chiropractor, stick with it, okay? And try to follow his care plan because it matters, right? When you cut a care plan down from 3 times a week to once a week, that's cutting it in third, your care in third. So potentially it could take 3 times longer. So something to think about. So we're gonna do something called the Logan Technique, and there are several, are you tender right there?
Yeah.
Okay. There are several, 4 specifically, ligaments that hold the sacrum to the pelvis, and they're called the sits ligaments, and those ligaments kind of float that sacrum and tailbone in the middle and between the pelvis there. And then you also have muscles that attach onto the pelvis. We won't get too much into that. We'll put up a diagram here of the coccyx for you guys to see what it looks like. And if you've ever slipped or fallen and you have pain on your tailbone when you sit, you should get that addressed because that could get worse, and that can cause all sorts of other problems just besides pain while you sit. It can cause some other neurological problems, numbness, tingling down into the toes. And typically when you fall on your tailbone or coccyx, that's going to shift things around in the pelvis, sacrum, and lumbar spine as well, and maybe even higher up into the thoracic spine. And that's what we found with him. It's been going on for a year. So when your tailbone shifts out of place, what do you think your other bones above that do? Your other joints above that in the spine? They compensate. So they start to shift. And then you start to develop back pain a couple months after that, right? So if you fell on the ice and you had back pain first or tailbone pain first, and now have back pain or tailbone pain, they're related most likely from that same injury, and the problem's just getting worse. So get that addressed right away. You don't have to have this technique, Logan Technique. There are several other techniques. We had another person in here that you saw, actually, right? You saw us treat her. Yeah. I think, if I remember correctly, we had to use laser therapy on her. So she was a pretty bad case, and in some situations, which we want to avoid at all costs, is an internal adjustment. And you know, that's uncomfortable, and it's uncomfortable for me to have to do it to a man or a woman. Okay, but that's an internal adjustment through the anus, and nobody wants that. So we do everything to avoid it. And laser therapy is one of those tools that we have really to help to reduce the pain and the inflammation significantly if this traditional chiropractic or Logan technique is not working. So far we've gotten 25% or so improvement with the tailbone pain. We'll monitor them, and in the next few weeks here, if it doesn't improve closer to 50% or more, then at that point we may use cold laser therapy or send him home with one of our rental lasers. Is that tender still?
Yeah.
Okay. So after this, we're going to check for his sacrum to be rotated. A lot of times when you hit your tailbone, it rotates your whole sacrum, because that sacrum, again, it floats. That triangular bone, it floats in the middle of the pelvis. So any kind of trauma to it can shift it, rotate it, clockwise, counterclockwise, forward and backward on one side or the other side. So we're going to check for all of that after we release all these tendons and ligaments in here. Tender right there?
Yeah.
Okay.
It's a little soft.
Okay. Were you doing a lot of sitting this week?
You know, I think I was probably taking a little advantage because I didn't have less pain. I was sitting a little more.
So you were sitting more, you said, because it felt better?
Yeah, because I had less pain.
Yeah. Try not to go too crazy with that. I know you feel better. It's like that happens a lot. We treat a patient, like especially with athletes, they're the worst about that. And I mean that in a good way. They're just so ready to get back out there and go running, and they overdo it. So just be careful of that, especially because I'm not able to see you 2 to 3 times a week, right? So if I was, then I would say I wouldn't make as big of a deal out of it, right? Tender there still?
No, it
subsided?
Yeah.
Okay. And that's when we know to move to the next spot. And how we doing right there? That's tender, yeah. Yeah, so if I don't see a jump here closer to 50% in the next 2 visits, we're probably going to start the laser therapy with you, okay? And by then your lower back pain should be completely resolved at that point. You can even use the laser on your lower back, but obviously we're really giving it to you for the tailbone pain. And I can feel it pulsating under my finger here. How's that feel?
Feels a little,
Less?
like a dim pain.
Okay, let me know when that subsides. So in my 22 years of, practicing, we have been able to avoid.
The pain subsides.
Yeah, okay, good. We've been able to avoid the internal adjustment. Tender right there?
No, not really.
Okay.
It's like I feel it more on the bone.
How about here?
No.
Okay, so lay on this side. Now what I'm gonna do is some ART, so active release technique for the muscles right here that attach the sacrum to the pelvis, okay? And I'll show you why we're gonna do that, because normally when he raises his leg, it's harder for him to raise this leg. So we just wanna loosen these ligaments and tendons up and let that sacrum fall back into place as much as possible before we start adjusting. So I am going to put my hand here, okay? I'm gonna have you swing your leg. You know how to do this. Bring your leg back to my hip, bring it to the wall there, Go ahead. Good, and back. Go ahead. Good. Okay. Is that sore?
Yeah, a little bit.
A little bit slower. Yeah, yep, that's when you should feel it. So this is also called pin and stretch, but ART is really the technique that took it several steps further. Some of the old school people might call it pin and stretch. Good. All right, you okay?
Yeah.
All right, lay on your stomach. So now what I'm gonna have you do is raise your leg one at a time. Go ahead. Good, and the other one? Okay, still harder to raise that left leg? Okay.
No, it's actually pretty good.
Yeah, they're both going up evenly. Now your pelvis is out of alignment. So when we adjust this pelvis, I usually like to do that first before I start adjusting the sacrum. So we're gonna have you bend your knees here. You can see here, this left leg here doesn't bend as far. So if you guys, it's hard for you guys to see because he's got black pants, but if you could see it with a white background, you could see this sneaker here, this right one here, pushes further, easier. This one, I'm pushing it to tension. It doesn't go, his ankle doesn't go to his buttock as much. So what that tells me is, and then when I look at his feet here, this leg is short by about a ½ inch. This leg that's tighter, that doesn't bend all the way. So that tells me that his pelvis is pulled back on this side. And then I just double check it, and sure enough, I can feel it pulled back on this side. And it's forward and higher on the right side. And that's gonna affect his sacrum and his tailbone, his coccyx. So we need to address that lower back, that pelvic instability. This side up. Yeah, the same way as before. Yep. Face me though. All right, bend this leg. Yeah. And we're gonna just correct this pelvis that's pulled back and down. And I'm gonna drive it forward and higher and relax here. All right, other side up. Although last week we adjusted him, and I swear the noise from the adjustment woke the neighborhood up. It was pretty loud, wasn't it, last time? Okay. Now that's just a byproduct of the adjustment, that cracking noise. I know a lot of you love to hear it. Now we're going to take the other pelvis. Oh. Relax yourself. Okay. All right, lay on your stomach. So that one I did gentler because I'm adjusting his pelvis and I'm pulling it down. Now, that's the last thing I want to do to his sacrum, right? So if I have my hand slightly off, that could make this worse, right? So we definitely don't want to do that. Now, his legs are even. Now we're going to bend him and watch this. you notice it too.
Oh, yeah.
So look at that. His toes are even here. And I'm not forcing it. I'm just going to the end range of motion, right? Just like before, right? And look at that. Now his legs bend evenly. That is just a telltale sign. That's pretty cool when you see that. Toes are even, see that? Okay, now let's have you raise one leg at a time. Good, and down. The other one? Great. This one actually comes up a little bit higher. Okay. Still tender there?
No.
There?
A little bit.
Let me know when that subsides. Okay. How about there? Right there?
Yeah.
Deep breath in and out. Let me know when that subsides. So the fact that he's had this for a year leads me to believe that we may end up having to use the laser on him. I may be able to get him 60, 75 to 80% better But we might need that other 20, we might need the laser to fix that other 20% of pain and discomfort, like from sitting on really hard seats, like on the bus or the subway, right? But, you know, obviously the fact that you've had it for years, not great, but better late than never, right?
Yep.
So turn over on your back and let's see your hands up. Relax your arms. Gentle one here. Okay, you're all set. Come on up. If you folks have any questions about tailbone pain, coccyx pain, feel free to comment below and get that taken care of right away. Don't wait because the symptoms can get much worse, and you don't want those really bad symptoms aside from just pain. Okay, and some of those symptoms could be numbness, tingling into the legs, issues with your bowels, things like that, sciatic nerve pain even, low back pain, things like that. So thanks for tuning in. Don't forget to hit that thumbs up button and subscribe. We appreciate you. Thank you.